Thank you, and thank the organisers very much for this invitation. It's a wonderful opportunity to be here among so many knowledgeable people on such an important issue and in such beautiful surroundings. Well, I'm going to take you all on a lightning tour around food safety in low and middle income countries from the perspective of international agricultural research. I'm based at ILRI, the International Livestock Research Institute, which is one of 15 CGIAR centres. I work in Nairobi, Kenya, but we do work mainly in Asia and Southeast Asia. So I started the first, although the CGIAR has always worked on specific food safety problems, hazards or diseases, we never actually worked on food safety as an entity, as a set of problems, which takes us a little back to Joachim's original recommendation that instead of thinking just about single problems, we need to think about systems. So I started the first CGIAR program on food safety as a systems problem back in 2006. And around then, I would say it was regarded similar. Foodborne disease had perhaps similar status to that of toenail fungus. Now, toenail fungus is not very nice, and definitely it's very common, but it's not really considered as a major public health crisis or as a huge barrier to development. And that, in the past 15 years, there has really been a sea change in the way people are thinking about food safety. And I would say that has been accelerating greatly in the last couple of years. And it's quite nice to be part of this movement. So why the change? I think there are three major factors. The first is in taking the broadest development perspective. It's been increasingly recognized that health is at the heart of development, and that it's not a question of just getting the economy right and everything else will sort itself out, but that health is actually a key cause of making people fall into poverty, trapping them into poverty, and what's more, investments in health are some of the most cost-effective investments in development possible. So health has been rising up the development area, and I would say that in agricultural research, which is where I come from, again, this productivity, it was farms first and productivity matters most, and now increasingly we're looking at the externalities, especially human health and natural environment. The second major change, the second major driver of this interest is this new thinking around burden, around health burden. So back in the 80s, I would say a lot of public health work was led by experts in subject matter. But you had somebody working on malaria for 40 years, and then you had the lady who'd been working on cyanide in cassava all her life, and they were all sort of working very hard, and they often had something in common, that they considered the problem that they were working on to be the single greatest challenge ever faced by humanity. And so when people started doing the sums, they found something quite interesting. When you added up the deaths of all the people dying from malaria and toenail fungus and cyanide, it came to around about 3 times as many people as were actually dying every year. So they felt that these people were pretty strong in advocacy, but maybe a little bit weak on evidence. And this led to an initiative by World Bank and WHO to really start trying to find out in a systematic way, not just my favorite disease, what is the evidence it's important, but what are all the diseases and how do they contribute to the burden of human disease, and bringing in new ways of measuring by combining mortality, morbidity. It was a huge endeavor and highly important in determining how investments were made in public health and how we thought about public health. But unfortunately, the way these initial burden assessments were organized, you couldn't really pull out rather important categories of disease. For example, zoonosis are hard to, these are diseases transmitted from animals to humans. And likewise, foodborne disease, because foodborne disease cuts across various different chemical, biological hazards. And what isn't measured tends not to be managed and is often underestimated. So a great initiative was started by WHO again, the Foodborne Disease Epidemiology Reference Group. More than 70 experts, nearly 10 years, came up with the first, most comprehensive, most credible estimates of the burden of foodborne disease and found that they were in the same order of magnitude, comparable to those of the big three, to those of malaria, HIV, AIDS, or TB. And this surprised everyone, I think. I mean, I've been working in health in developing countries for 20 years, and I think nobody really expected that number to be so big. And that number is now making its way, as numbers do. It's not perfect, we all know that, but it's the most credible and comprehensive estimate we have, and hopefully will only get better. So that's the second reason, but the third reason, and this takes us back to Jessica's very nice presentation, is that evidence only goes so far. And the thing about food safety and foodborne disease is it makes people mad. Now, nobody gets really mad about stunting or obesity, and that's a shame, and maybe they should. But once people start hearing that there's dioxins in their pork, or there's melanin in their baby's milk, or there's, even worse, there's horse in their beef lasagna, they get really furious. And this makes it, and then it gets into the media, and we know if it bleeds, it leads. And we know also that when the public care about something, the politicians start listening. It's hard to a ministry is something which is hard to dismantle, but food safety is one of the issues which really has led to complete restructuring, destruction of ministries of agriculture and reorientation of ministries of food safety in Britain, Australia, China, many other countries. So for those three reasons, I think food safety has been rising up the agenda, and it's likely to become even more prominent. A very large burden, an unexpectedly large burden. 98% of that is borne, this is all from the WHO FERG study, 98% of it is borne by developing countries. Children under 5 bear disproportionately high burden. 97% of this burden is caused by biological hazards and 3% by chemicals, although there is further data on chemical hazards which is due to come out. But in the 2015 version, we can see a predominance of biological hazards, which is what most food safety experts hold to be true, whereas many lay people think it's the chemical hazards which are, and we often say in food safety, what people worry about and what makes them sick and kills them are not the same. So that's a take-home message for you, because almost always the policymakers and the lay people, they worry about the things which are not making them sick and killing them. So a huge burden. And another worrying thing about it is it appears to be getting worse. Now here the evidence is a little less strong. There's good evidence from some developed countries that, for example, in America, where the CDC, in the USA, where the CDC keeps good records, from 2006 to 2016, there was no overall improvement in food safety. And that was despite a lot of investments and a lot of efforts. And we've been doing some work with Wageningen University, particularly looking at the case of India, where it seems that foodborne disease is going to increase quite substantially by 2030. A lot of this increase is driven by something which is quite good. That is an increase in consumption of the riskiest foods. And here we go back again to systems problems, because the riskiest foods are also the most nutritious. Again, evidence suggests that the majority of foodborne disease is caused by animal source foods and fresh fruit and vegetables. And of course, these are things which we want many of the malnourished people to be eating just more and more of, but there's no point in getting them to eat more of it if it's going to make them sick and kill them. So an increasing burden, and also not just a health burden, but also an economic burden of enormous impact, both in terms of people's health, healthcare costs, lost production, and trade. So that's talking about the magnitude of the problem, but I guess what's even more important is what can we do about it. I think we've learned more about what we can't do about it over the past 10 or 15 years than what we can. And a couple of lessons. The first is that we can't regulate our way out of food safety. So an initial response to food safety was thinking we just need to modernize the system. We know in a lot of developing countries food systems are very fragmented, multiple ministries, old-fashioned ways of thinking about hazards and risks, inappropriate standards. So there was a lot of effort put into modernizing food safety systems. I must say this is highly important. We need to have a proper regulatory system in place. But what we found was that this is necessary but not sufficient. So we've now looked at several countries which really did an excellent job at modernizing their food safety system, Vietnam being one. No improvement on the ground, because although these excellent things were happening in the capital city, none of it was trickling down to the informal markets, the kiosks, the fast food, the ready-to-eat, which is where people buy most of their food. So we can't regulate our way to food safety. We've also done some interesting research suggesting we can't modernize our way to food safety. And many of the policymakers we engage with assumed that if we had a modern food system, modern retail, hypermarkets, cold chain, industrial agriculture, a part of it was related also to the bird flu epidemics, when there was a sort of a pushback against the small-scale agriculture, which was associated with spread of pandemics. So one of our most surprising findings, and I always get pushback against this, so I'm glad I only have another 4 minutes so nobody can contradict me, is that in poor countries, in low and middle income countries, food sold in modern retail is often no better and often worse, less safe than the food sold in the informal sector. And there are various reasons for this. But we've done this study now in 10 or 20 countries, and it is clear that simply modernization, industrialization will not bring us food safety. Although food safety, of course, food is much safer, of course, in rich countries. And the third thing which doesn't work is training. There's a very common, how shall I say it, belief among development communities that if you just capture enough people and train them, all will be well. Now, training in the absence of incentives, training in the absence of changing people's reward and punishment structures is a complete waste of time. So it's sad to see it is still being so much the default. What does work? So our own work and our reviews of the subject suggest there are 3 pillars for safer food. The first is an enabling environment. So certainly the regulatory system must be conducive to producing safer food. And often, for example, people are punished, and we know that this, what we call command and control, inspect, detect, punish mode, doesn't work. It didn't help people stop producing gin in 1930s America. It's not going to stop people producing unsafe food in Africa today. So it needs to be an enabling regulatory system that actually helps people produce more food and doesn't just look to punish or to make money out of, to regard food safety as an income generation device for government authorities. Secondly is capacity. There's been a lot of efforts in improving farmer capacity, but the informal value chains that these vendors, the street food vendors, the people who retail in kiosks and open markets, who are selling 90% of the fresh foods, these fresh, risky, nutritious foods, around 80 to 90% in Asia, South Asia and Africa are being sold in these informal, fresh or wet markets. They've been ignored. They are a low-hanging fruit which has received minimal training, minimal support. They need capacity, they need simple technologies. But as we said, neither the regulation nor the capacity building will have any effect unless there are incentives for behaviour change, unless there are motivations to change people's behaviour. These we see several important levers. One is public demand. Everywhere where food safety has improved, whether it was Britain in the 19th century or America in the early 20th century, this was always led by public pressure. It never came from the top down. It always came from the public pressure. Unfortunately, public pressure is often very ill-informed. People worry about the wrong things. They don't worry about the right things, and they don't know how to translate their demand for safer food into pressure. But we have some mechanisms whereby this can help. And other interesting areas are just for example, training and certification, whereby traders, if they can get certification, they can avoid harassment by authorities, or they can market themselves to consumers. Behavioral nudges also suggest some ways. So basically, we need these 3 components. We need an enabling environment, we need capacity building and technologies for the people selling food, and we need motivation and incentives for behavior change. So coming to the end, we've just been working on a couple of reports with the World Bank, one which Steve has been leading, and you'll probably hear more about, so I won't talk about that one, but another one was with the Global Food Safety Partnership for Africa, and that came up with 3 key messages for better management of food safety in Africa. Put health first. It looked at all the investments of the past 10 years, and human health, the health of the African consumer was typically at the bottom. We say this should now be at the top. Risk-based and evidence-based. Too much of previous investments have been hazard-based. People find their favorite disease and they just invest in it and keep on finding more reasons why they should invest in it rather than thinking about the whole evidence of foodborne disease. What are the vital few? What are the trivial many? How can scarce resources be best invested? And lastly, market-led and demand-based. That we won't get safer food. We never got safer food anywhere else in the world without putting the consumer first. So therefore, we're unlikely to get safer food in Africa without consumer first thinking. Thank you for listening.